Okay, so hi everyone, and thank you for joining me during your lunch break for this presentation. So like Amy said, this is going to be about how immigration policy impacts health and care provision in the UK. I'm Francesca, and I'm the Advocacy and Campaigns Officer at Undocumented Filipino Consortium. So I do immigration casework and campaigning for undocumented Filipino migrants in London. And we are a founding member and signatory of the Status Now for All network. So I'll just talk to you a little bit about Status Now, the Status Now network, or SNN as it's known. So it was established and founded, or people started to come together at the beginning of the pandemic, so around March, April of 2020. In response to the pandemic, and kind of with the knowledge that because of the immigration policy in the UK today, many people were going to be cut off from healthcare, from government support because of their immigration status. So a group of individuals and a coalition of individuals and groups advocating for the rights of migrants came together to make the following demands. That all undocumented migrants and migrants in the legal process be granted status immediately or regularized. Access to universal healthcare, work and housing for all, and for an end to the hostile environment policy. We are a single issue campaign, so the only thing that we work on and that we campaign for is Status Now for All, because again, we're a coalition of lots of different groups. So individually, we might have different advocacies and different campaigns. So for example, Ganungan works for the empowerment of Filipino, East and Southeast Asian migrants. So we do other things outside of this specific area of work. And we have regional groups. So we have a London group, a Scotland group, a Northeast and Northwest group, and they have regional coordinators. And the idea is to build a coalition and harmonize actions and activities across the UK, signpost events and activities to be supported, create safe space and a political home for disparate groups and individuals who might be campaigning on similar things. So making sure that we're all kind of broadly working towards a similar goal, and encouraging and pushing each other in our activism and solidarity. And these pictures are from actually nearly exactly a year ago, on the 19th of July 2021. We did a solidarity demo outside of number 10 Downing Street, because there was a debate going on in Parliament around the regularization of all undocumented migrants, which was put forward. It was I can't remember what the exact political term is, but it was put forward by Claudia Webb, and so as to table that debate in Parliament. So these are some members of Ganungan and of Status Now network. So I thought I'd start off with an overview of what the hostile environment policy is. So essentially, it's a body of legislation and changes to immigration policy since 2010. And the main acts that have really legislated it, codified it, are the 2014 and 2016 Immigration Acts. But it's also important, I also think it's important to say that under the Blair government, really awful immigration policy was also passed. So for example, mandatory deportation of any person who is sentenced to 12 months of, who receives a 12-month custodial sentence and over. So these are all things that existed before that, but really it's the Tory government that then kind of took it to the max, I guess we could say. And what's also really particular about the hostile environment policy is that it's not just immigration enforcement and immigration regulation. It really reaches all aspects of the community and public services. So for example, there are prohibitive costs associated to making applications to the Home Office. So to give you an idea, to register a child for British citizenship, it will cost you £1,100. So there are children today who are growing up undocumented in the UK, even though they have a legal right to citizenship and are citizens, essentially, but can't get the paperwork because it's too expensive and parents can't afford it. For an adult, it's approximately 1,500. So again, people who could be getting citizenship aren't getting it because it's just too expensive. And similarly, all of the applications are really expensive. And because the government has been cutting down on legal aid, there are fewer and fewer applications that are covered by legal aid, meaning that people can get legal representation for free. And because applications are so complicated, it's really important that you get the support from a professional advisor, so like a solicitor or a caseworker, because otherwise your application will be refused if there's any mistake and you can't get a reimbursement for the fee. You need to just apply again and pay again. So there's also the no recourse to public funds condition. So that is a condition attached to most visas that aren't long-term visas or settled visas. So if you don't have settled status or indefinite leave to remain, for example, you'll have no recourse to public funds. And of course, if you're undocumented, by default, you have no recourse to public funds. That means that you can't access any kind of benefits, welfare or government support. And that includes, for example, access to a refuge if you are a survivor of domestic violence and you need to somewhere safe to stay. Usually you won't be able to stay in a refuge because that is considered a public fund because it's paid for using housing benefits, essentially. So if you do have no recourse to public funds, then you'll need support from a specialist organization that will essentially pay for you to stay in a refuge or an emergency accommodation. And also free school meals are considered, children who have no recourse to public funds can be excluded from free school meals because usually you need to prove that you're in receipt of benefits in order to qualify for free school meals. So obviously, if you're legally banned from receiving benefits, then your child might not be able to have free school meals. There's also the NHS surcharge payment for all migrants. So that's the international health surcharge. And that's about, I think it's between £250 to £300, which you need to pay every year if you're a migrant in order to use the NHS. There's also data sharing between the police and the Home Office for the purpose of immigration enforcement and I guess just law enforcement in general. So we know of cases where, again, situation of domestic abuse, for example, the woman calls the police to intervene because she's being physically attacked by the perpetrator. Police show up, perpetrator says, well, she is actually undocumented, and the police will act on that. And women have ended up in detention because of this. There's also the criminalization in general of work by undocumented migrants and those without adequate paperwork. So it's illegal to work without the right visa. And undocumented migrants also don't have the right to rent. And now immigration checks need to be carried out by private like landlords in order to check that people have the right to rent. Okay, so I'm now going to talk about the experiences of migrant health and social care workers in the UK. Oh, thank you for the info about the surcharge. What we saw, for example, during the pandemic is that there was a disproportionate impact on BAME and migrant workers. So, for example, Filipino staff make up about 3% of NHS nursing staff, but 1 in 4 COVID-19 deaths amongst NHS staff during the peak of the first wave. So these are numbers that Ganungan, the organization I work for, put together based on community reports and information that we were finding online. Researchers found widespread systemic racism and discrimination towards BAME and migrant staff in hospitals and care homes. So we worked on this Nursing Narratives project, which I'll send around the presentation and people can have a look at the research that was done. And essentially what happened is that BAME and migrant staff were being put on the front lines and being forced to do all of the most precarious and dangerous work. So working the COVID wards, doing triage, sometimes without PPE, being given PPE last. And really there was like an element of real like manipulation and discrimination going on, because we would hear from new nurse arrivals. So, you know, they've only been in the country for 2 weeks. They don't even know where they can get their groceries to eat. And they're already being made to work in the COVID wards. And obviously that's a strategy that NHS management is using, because they know that these new arrivals don't necessarily know about their rights, haven't necessarily joined a union yet, don't have a community of support yet, so aren't able to really refuse the work that's being given to them. Also, in a lot of these cases, if you don't pass your probation period, so if you leave before your probation period, then you might not be reimbursed for the cost of your visa, for the cost of your international health surcharge, all of these things. So really, people are being actively discouraged because of the immigration system from speaking out and, you know, refusing to work when they felt unsafe to do so. And yeah, the international health surcharge was still being paid by health and care workers, but I think sometime last year that was scrapped. And also in general, there's the tier 2, or now what's known as the skilled worker visa, is extremely precarious. So you are sponsored by your employer, and if you leave your job because of whatever reason, you have 60 days only to change your sponsor. And if you can't find a new sponsor within 60 days and have that registered with the Home Office, then your visa is curtailed and you need to leave the country. So, I mean, can you imagine having to find, you know, let's say you working in a hospital and, you know, you've been pushed to the point of burnout, and then you have 60 days to find a new job. I mean, I think a lot of us would, I mean, personally, I would struggle to find a new job in 60 days. And that's without the additional pressure of it, you know, being tied to my right to live and work in this country. So beyond that, there's also a lot of immigration enforcement that happens within the NHS. So what we find is that even though it's not required at the primary care level, so when people are registering with a GP, for example, GP surgeries will ask migrants for proof of ID, proof of address, and proof of immigration status, which means that people, if they, for example, are like bed sharing, couch surfing, don't have permanent accommodation, or don't have an address that they can list, means that they're being excluded from that. Also, if they're being asked for proof of ID or immigration status and they're undocumented, then I know from my casework that people just give up and don't see a doctor. So I've had clients who haven't seen a doctor in over 15 years because they're too scared of registering with a GP surgery, or when they have tried, they've been asked for their paperwork. Immigration checks are carried out at hospitals. So there's an overseas team in every hospital that will assess what non-residents should be charged. And for example, if you're undocumented, then you'll be charged 150% of what it actually costs the NHS. And they have, like, that immigration check happens because there is data sharing between the NHS and the Home Office, and the NHS basically can access any person's immigration history in order to understand how much they should be charged. Like I mentioned, there's also the international health surcharge for migrants. And then there's also data sharing between the NHS and Home Office if people owe debt to the NHS. So let's say the kind of case that comes up all the time is women who have no recourse to public funds giving birth in a hospital, and maternity care is considered secondary care in the UK, which means that it is not free and people need to pay out of pocket in order to give birth in this country and receive care. So we've had some of our clients have bills of up to £15,000 because they've had a complicated birth, for example. And when they've tried to apply to renew their visa, it's been refused because they owe debt to the NHS. So if you owe any kind of debt to the NHS, and you can't prove that you're trying to pay it off, then that's a mandatory refusal from the Home Office. On top of that, if after 2 months you still haven't started paying off your debts, then the NHS is obliged to pass that information to the Home Office, and the Home Office can essentially arrest and detain that person to be removed from the UK. So I'll just take you through a case study. There's a lot of text, but I just think it's a really poignant example of the kind of immigration enforcement that happens at hospitals. So Nora is one of my clients. She was trafficked by an agency in the Philippines when she was 17, and they issued her with a passport that had a false name and a false date of birth. So she was 17, but on the passport it said that she was 25. She went to work in a Gulf country, and then her employers brought her to the UK as a domestic worker. But because of the abuse and exploitation that she was experiencing, she ran away in 2020 and has since become undocumented. But then in the past few months, she started getting really, really awful pain in her lower abdomen. And after going to A&E, they saw that she had an 8-centimeter ovarian cyst. This treatment was not considered urgent and was not considered life-threatening. So even though she literally couldn't stand from the pain, they wouldn't operate her on an emergency basis, and they also wouldn't operate her until she agreed to pay over £3,000 in fees for the surgery. Basically, there's an exemption to the charging if you're undocumented, where if you are considered to be a victim of human trafficking and modern day slavery, then you can get NHS treatment for free. So we referred her to the National Referral Mechanism, which is the specific authority that deals with deciding who's a victim of trafficking or not. And the overseas team agreed to waive the fee. But when we brought her to her appointment for her surgery, we found that the overseas team had not communicated any of this updated information to the medical team that was going to operate her. So when we contacted the overseas team, we explained that she'd been trafficked, that the age that they have recorded is not the correct age, that the name is not the correct name, and that also she is a survivor of trafficking, exploitation, and sexual assault. So all of this needed to be taken into account in terms of her medical care. That information did not make it to the medical team, and when we disclosed it to the nurse, she did not understand. She told my client that she was lying, and that she should be charged and that she would have to pay after the surgery. Thankfully, because I was there, I was able to just immediately explain what was going on, and in the end she was not charged and she was fine. But what we can see here is that, first of all, hospitals are more concerned with charging people rather than safeguarding them and treating them. And there were some serious failures at the hospital. So for example, when the hospital carried out an immigration check and saw that she arrived on an overseas domestic worker visa and that she ran away from her employers, they should have immediately launched the safeguarding procedure that they have, and immediately considered her as a potential victim of human trafficking or modern day slavery, and immediately carried out an assessment along those lines. There was a lack of internal communication at the hospital. Apologies for the typo on communication. And overall, just a lack of safeguarding and lack of access, just no knowledge within the hospital staff about how to support this kind of case. I think I'm going to speed up because I think we're coming up to time, but I just also wanted to talk about specifically the experiences of undocumented migrants during the pandemic, because it was really, really awful. So migrants were systematically asked for proof of ID, address, or right to live in the UK when trying to access primary healthcare. There was an inability to self-isolate because there was no sick pay, no furlough scheme, no social and economic safety net, and a lot of people were living in overcrowded accommodation. And because a lot of people are working, in cash in hand jobs, they don't have a contract. They have basically no labor rights. It was especially precarious for live-in carers and domestic workers because they are living in their place of work. And so if they got COVID or if their employee got COVID, and were made to leave, then they also became homeless. Again, people experience high levels of NHS debt. There's increased destitution. And then because of all these things, really low trust in NHS services and in the vaccine due to the fear of immigration enforcement. So there are a lot of undocumented migrants who simply did not want to take the vaccine because they were scared that if they took the vaccine, then the NHS would have their data, and then that data would be handed over to the Home Office. So in response, a lot of community organizations like the one I work at hosted pop-up community vaccination clinics so that we would facilitate the vaccination and hold the data, and they were still able to get their vaccination. So these are 2 case studies to give you an idea of what our community members went through and what undocumented migrants went through during COVID. All of these are not their real names. So one of our community members, Elvis, died of COVID-19 in his home without getting treatment from the NHS because he was really scared of being reported to the Home Office and therefore deported. So he died at home with his wife caring for him. And he'd been in the UK for more than 10 years and he was working as a cleaner. And this is not, there were many cases of undocumented migrants dying at home without access to medical treatment because the fear of detention and removal from the UK was so just completely outweighed everything else that they were going through. Jane was 5 months pregnant at the height of the pandemic, and she saw NHS services. She was then referred to a caseworker. She was undocumented, and that caseworker in social services reported her immigration status to the Home Office. She had to transfer locations multiple times when she was 5 to 7 months pregnant because she was so scared of being arrested and detained and removed. So what can we do? What are our policy recommendations? So what's really clear to all of us in the sector is that the hostile environment policy is a public health disaster. The no recourse to public funds condition absolutely needs to be scrapped. There needs to be a firewall between the NHS, police, and immigration enforcement. It is unacceptable that the NHS can carry out immigration checks and that the NHS can forward information about patients' immigration status to the Home Office for the purpose of immigration enforcement. There needs to be clear communication on the rights of undocumented migrants and homeless people with regards to access to GP registration. There needs to be community outreach to facilitate GP registration. The international health surcharge needs to be scrapped, and all undocumented migrants and those in the legal process should be regularized immediately. I've listed here some resources. I won't go through everything now, but it's just for you to look at later on. The GLA just released a report about exactly what I was talking about, people really struggling to register with the GP. Then there's 2 reports that Ganlungen wrote, and then some articles that either we worked on or people in the sector worked on about immigration enforcement and immigration policy in the context of the health and care sector. And then if you want to learn more specifically around the overlap between immigration enforcement and immigration policy and access to health and social care, I would really recommend that you check out Doctors of the World, Patients Not Passports, Docs Not Cops, MedAct, and Medical Justice, which are all specialist organizations and have some really good resources and information. So, for example, Doctors of the World has leaflets in I think like 20 languages about how to register with a GP if you're undocumented. And then Medical Justice is a specialist organization that advocates for the rights of detainees to access healthcare while they're in detention centers. And then Patients Not Passports, Docs Not Cops, and MedAct all help with advocacy for migrants' rights to accessing healthcare. And that's it. I'm going to stop recording now.